Carle combines clinical care, health insurance, and research in a way that solves problems today with an eye toward the future. Supported by a deep philanthropic spirit and dedicated to making life better for as many as possible.
Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
At HS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HSHS St. Anthony's Memorial Hospital.
Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System.
Hi, I'm Kian Armstrong, your host for Being Well, and today we're going to be talking about cardiology, all of the different aspects of it, as well as the Heart Center at Sarah Bush Lincoln Hospital. And today joining me is Dr. Michael LaMonto, a cardiologist with the Prairie Heart Institute and working at Sarah Bush. So thanks so much for joining me today.
Thanks for having me again.
Yeah,
it's a pleasure.
Well, good. I'm glad that you're here. You were on last season, but cardiology is a big topic among a lot of people, so I'm glad that you're back to talk about it.
Thank you so much.
So we're going to talk a little bit about, first of all, the partnership between Prairie Heart and Sarah Bush. So you're affiliated with both, so
Yes.
explain that to people.
Well, originally, it's an interesting partnership because I was originally a Sarah Bush doctor when I worked in the emergency department. My family came down here in 2005. It was my wife and I started working in the emergency department here, and I worked there for 8 years until I ended up having a motorcycle accident, which changed our lives, and I ended up going back to school for cardiology. And by the time we came back, the cardiology department had been having problems finding steady cardiologists to work. Believe it or not, even though I love it down here, it's hard to find physicians sometimes, especially specialty physicians, to come to a less metropolitan area than Champaign or Chicago. And so to help out with cardiology coverage to ensure that we had cardiologists to take care of the people of the community here, Sarah Bush partnered with Prairie Cardiovascular, which is a cardiology corporation group of doctors. There's 72 of us, and they partnered with them to say, we would like you guys to come to Sarah Bush to cover all of our cardiology needs.
Okay. Now, where is Prairie Heart? Where is it located?
They're based in Springfield, Illinois.
All right.
And so for the last several years, Dr. Dande and Dr. Cahill had been working at Sarah Bush. I came on about 2 years ago after I finished my retraining. And since then, just recently, in fact, Dr. Cahill has left to go back home to St. Louis, where his family lives. And we have now gotten a new physician who used to work up in the Chicagoland area for 10 years. His name is Dr. Traeger. So now it's myself, Dr. Traeger, Dr. Dande, and we are Prairie Cardiovascular cardiologists, but we work solely at Sarah Bush Lincoln.
Okay. So do you all have different specialties? Do you all do the same thing?
Well, we're all cardiologists.
Okay.
I am what's called a non-interventional cardiologist. I see patients in the clinic, take care of patients in the hospital. I can do cardiac catheterizations, I can do loop recorders, cardioversions, special echocardiograms, things like that. And so can Dr. Traeger, but I cannot put in stents. That is left for Dr. Dande, who's what's called an interventional cardiologist.
Okay.
So we each have a role. We're a team that works together, and we each have a specific niche that we fill in. But together, it's pretty complete coverage.
Yeah, so you work as a team. Yeah. Well, you've listed off a number of different things there that I want to delve into a little bit deeper and explain to our viewing audience. You know, you mentioned heart cath and EKG. Let's talk about some of the diagnostics that a patient can get if they're a cardiology patient, and how
Sure.
they get to that point of knowing, yeah, these are some things that need to happen to me. So let's kind of walk a patient through a little bit,
Sure.
what it would be like. So where do you want to start?
Well, let's start. You see your family doctor, okay? And you have symptoms that make the doctor concerned about a heart problem. Let's say chest pains. That's
Okay.
a very common complaint that we have. Your family doctor will likely do an EKG. An EKG can be done anywhere. It can be done in the office, it can be done at the hospital, a cardiologist can do it, a family practitioner can do it, anybody can order an EKG. And what that does is that's an electrical tracing of the rhythm of the heart.
All right.
And it can tell us if the heart is in regular rhythm, which is called sinus rhythm, or it can show us if the heart is out of rhythm, like things called atrial fibrillation, or many other kinds of heart rhythm problems, but it can also show us signs of damage to the heart as well.
Okay.
Now, that's a screening test that almost anybody can do. And if there's concerns on that, or if there's concerns by your doctor, you would be sent for something called a stress test.
All right.
A stress test can be anywhere from you get on a treadmill and you work out until you sweat a little bit, get that heart rate up, and we watch your heart. And we could take pictures of your heart with ultrasounds. We have things called nuclear cameras that can take very detailed pictures of the blood flow of the heart.
Does that involve an IV then?
Yep.
Okay.
Most of them do.
Okay.
Most of them do because, you know, in this day and age, we have the technology not only to do the basic stress test, which is you run on a treadmill and they do an EKG and they check it. Okay, and that's appropriate for some people. But for many people, we also add imaging onto it, either an ultrasound, a nuclear camera picture, things like that, to increase the sensitivity so that we don't miss any disease.
Okay.
So let's say you have all that done and now one of those tests is abnormal. Well, then your doctor sends you to us, to a cardiologist. We go through everything. We go through your medical history, all of your medications, your family history, what your cholesterol is like, what your habits are like. Are you a smoker, a drinker, things like that? And if there's red flags that pop up and we're concerned that you might have blockages in the arteries of the heart causing your chest pain or trouble breathing, sorry, I hit the thing again. If there are problems that we can identify, then you might go for something called a cardiac catheterization.
Okay. Explain that to people,
Yeah.
because there's a couple of different ways to do that, as
Yes.
I understand.
Yes. The most popular way that we do it now is we actually go through the wrist. We go through the right wrist with a small needle, go into the artery of the wrist.
Okay.
And what we do is we float a catheter all the way up the arm, right to the top of the heart. And once we find the coronary arteries, there are two major branches. You squirt a little bit of dye in there, and you take a picture on the x-ray. That's all in the cath lab room, and we can see your arteries on a big screen TV, and we can see if there's blockages or not.
Okay.
And if there's blockages there, that's when people get a stent.
All right.
So Dr. Donde again goes in there, he finds the blockage, puts a little wire down there, blows that up with a little balloon to get the plaque out of the way, and puts a stent in there to hold it open. And basically you've been, your plumbing has been redone and you have blood flow again to that area and you're doing better and hopefully the symptoms go away.
All right. Now, I've heard, people say, yeah, I had a blockage, but they didn't put a stent in. Does it have to be a certain percentage of a blockage?
Yes.
Or how do you determine
Yes.
when a stent is needed?
Well, let's say the gentleman sitting across from me at the office is 65 years old. I'll say, every house that's 65 years old is going to have some rust in the plumbing, okay?
Yeah, that's one way to look at it.
Right, but it's just rust. So you don't really do anything until there's a hair clog
Okay.
and the flow is impaired. All of us build up plaque. All of us have cholesterol in our body, and we're all going to have a little bit of plaque in our arteries. As long as it's not interfering with the blood flow, it's not affecting your heart at all. So we actually will see people with 20%, 30%, even 50%, 60% blockages. But as long as it's not interfering with the flow of the heart, you don't mess with those because we don't want to be sticking things in people's bodies that they don't need.
Right.
So once the blockage is around 70%, that's when it begins to restrict flow. If you think about it, if you turn on your hose in the garden and you squeeze just a little bit on the hose, it doesn't do anything. You squeeze a little more and it starts to make some noise, but the flow out the other end is perfectly fine. It's only until you squeeze real hard that you're going to affect flow at the other end. That's the kind of flow that we put a stent in to reduce.
And what are stents made out of? What are they exactly?
They're really complicated. There's platinum and cobalt and manganese and, they look kind of like chicken wire, real small chicken wire, but they're very complicated metals so that they don't react with people's bodies. And they're coated with something called the drug-eluting stents. They're coated with a medication to make sure that the body doesn't have this really brisk inflammation and swelling that's associated with sticking something in an artery. And that has, over the last 20 years, the technology of those stents has improved greatly.
Yeah, I bet.
Yeah.
Lots of things have improved over the
Absolutely.
years. So you mentioned that it's more popular, I guess, to go through the wrist. The other place was the groin?
Yep, the other place is your right groin.
Okay.
Now, the reason why this is more popular, it's much more comfortable. The chances of you having a bleeding complication is much less, because if it starts to bleed, you just go like this and it stops, you know. If it's the artery in your leg, the artery in your leg is much bigger in diameter and the flow is much faster. So it's a little bit riskier, but again, the risks are very rare. Complications are very rare. I tell patients, I say we do about 7 of these a day.
Really?
It's a very common practice, a common procedure that we do, and our complication rates are very low. Dr. Donde is very good at what he does, and sometimes you have to go through the leg, especially if you've had something like heart surgery, and you can't get all of the grafts that you've got put on your heart. You can't get to all of them through the wrist.
Okay.
So sometimes you have to go through the leg.
Right.
Sometimes people are born with a loop or a blockage or something that you can't get through either. So there's a lot of reasons why we have to use the leg.
Okay. Before we move on to any other diagnostics or treatments here, I want to talk about the age of people. We talk about mostly cardiology when people are maybe in their, 50s, 60s, 70s range. What about kids? I mean, does this type of thing, do you do heart caths on kids? What kinds of things come into play younger?
Actually, that is a whole specialty in and of itself.
Okay.
There are actually pediatric cardiologists that do that.
All right.
We at Prairie Heart and also at Sarah Bush, we only take patients 18 years old and older.
All right.
Because those are considered adults. The pediatric age group is completely different. Now, there are many people who are born with heart defects. Once they become of age, they're now followed in our clinic. And so we will follow congenital heart disease patients, meaning you're born with a hole in your heart,
Yes.
or you're born with an abnormal valve, or you had heart surgery as a child. These are things that, 50 years ago, children were dying at 6 years old because of this. But now people are living full lives into their 50s and 60s and beyond.
Lots of new advances.
Oh, yeah.
Helping people live longer, it
Absolutely.
sounds like. So something I hear a lot about is AFib. And I want to talk about that a little bit, because some people have told me they can feel it as soon as it goes out, and some people say, I don't know if it's in or if it's out. So what do you do about people who are in that category, and what's the diagnosis, what's the treatment? Let's talk about that.
That I tell all my patients, I say atrial fibrillation is a moving target. Everybody is different. Some people, like you say, they have no idea they have it. They could be walking around with a heart rate of 140. No idea. They don't feel a thing. Other people can go into AFib and all of a sudden they just feel terrible. They can't breathe. They're having chest pain. They feel like they're dizzy, lightheaded. Everybody is different. So it actually depends how aggressive we are with this. It depends on how they feel.
Okay.
There are people that they're in atrial fibrillation, and other than thinning their blood to prevent a stroke, which is the major problem that can happen with AFib, we just leave them alone and they stay in AFib forever, and they feel perfectly fine. Yeah. There are other people that feel terrible, and we work really hard to keep them in what's called sinus rhythm. That's the regular rhythm again.
Okay.
And you can do it with medications. We do things called cardioversions, where we can try to use either electricity or medications to actually reset the heart rate. There are specialists called electrophysiologists. One of them comes to Sarah Bush twice a month. His name is Dr. Scherschel. He does special procedures called ablations, where they find the extra focus of activity in the heart and they zap it with a little microwave or a little heat and actually stop that little focus from firing. He can also do pacemakers. There are many things you can do for AFib patients, but as long as they feel good, you don't do things to people if they feel perfectly fine.
Right.
Leave well enough alone sometimes.
Leave well enough alone.
Yeah.
So talking about some of these different diagnostic screenings, different things like that, I mean, people, will complain about shortness of breath, chest pain, things like that. Do any of these tests or diagnostic screenings hurt? Like the stress test, the heart cath, the stents, like, does it hurt?
Sometimes when we do a stress test, we are trying to push the heart to show us that something is wrong. So it's not uncommon that people are running and they're starting to feel that pressure, but that's what we want. We want to figure out what's going on with you. And sometimes you do have to cause a little bit of discomfort in order to diagnose and treat people.
But you're monitoring at the same time, so you're not going to push too far.
Yeah, no, absolutely. And there are times when somebody is on the treadmill. In fact, just today, I had a patient on the treadmill. He had a very abnormal test. I called the cath lab. Dr. Donde was available. We said, let's go right to the heart cath. And they went and he got a stent fixed and his artery is open now. And
so is that like a go home thing? Do you stay overnight? What's the time frame?
Again, that depends.
It depends.
If we do this early in the morning, sometimes people go home the next day. People come in as outpatients even, and they get a stent and they go home. Now, if they've been hospitalized for other reasons and then they need an intervention, then they'll be back in the hospital, or if they're sick for other reasons, or if they're frail, or if they need to set up care at home before they go home, of course, we keep them in the hospital.
Okay.
But a lot of people get a stent and they go right home.
Right home.
Yeah.
Feel better, and they're off to go to work or off to go play or whatever they want to do, I guess.
Right.
So what about pacemakers? Is that the same type of thing? It depends on, is it an in and out thing?
Very much. Okay. Again, if it's first thing in the morning and they're doing fine at, after lunch and they're feeling fine, they can go home. Sometimes, people stay overnight. It all depends. Everything in medicine, the answer is always, it depends.
It depends.
Right.
It depends on the body, the age, and the problem, I guess.
Right.
So let's talk a little bit about blood pressure because, there's lots of medications, lots of things out there. Blood pressure can lead to cardiology problems. So talk about blood pressure.
Blood pressure is called the silent killer, Blood pressure, you don't feel it, you don't know it, you don't know, like you wouldn't know what your blood pressure is right now. I don't know what my blood pressure is right now unless you check it. But if you live long term at a high blood pressure, that pounding of that blood pressure on the little capillary beds in your organs, like your eyes, your kidneys, your heart, your brain, that will cause, over the long term, it can cause damage over time. And so we control blood pressure within certain parameters. And again, everybody is different. Where do we shoot for? What do we use? Everybody's very different. But we try to keep people's blood pressures in the normal range to prevent long-term complications.
Okay. So once again, it depends.
It depends.
It depends.
It does.
What about disease management? Talk to me about the different things that are offered as far as managing heart disease.
Well, actually, that's something that really is interesting with the new heart center that's coming up. We have a program called METS, or cardiac rehab, and there's a lot of people in the community that go to this. There's also, within that cardiac rehabilitation area, there's also a pre-diabetes class called Living with Diabetes. These are all aimed at disease management. Now, people look in the windows and they see a workout area, treadmills, stationary bikes, things like that. And yes, there is exercise that goes on there, and it's supervised by exercise physiologists and by nurses, but it's far more than that. The disease management comes in a couple of different ways. People attend these classes on a regular basis. They get to know the nurses that work there. The nurses know me. And I tell all my patients, after they get a stent, they're referred there, and they start working out and they start doing things, and the nurses talk to me on a constant basis. Hey, Mr. Johnson's blood pressure was up today. Okay, we can tweak some medicines. Or, let's just keep an eye on it, see what happens. He just got a stent. And again, it all depends. With the cardiac rehab classes, if they start having more chest discomfort when they're working out, that may signal a problem. If their blood sugars are up or down, or if they don't feel good, or if they feel like they're going to pass out, those are ways that they can manage their disease with my help, and we partner together. So even though I'm not seeing the patient 3 days a week, I have eyes in the cardiology Mets area to watch them for me. The other thing is these nurses and the techs, they teach unbelievably well. They talk about cholesterol, blood pressure, diabetes, heart disease, smoking, COPD, all kinds of things. So this area is not just where you're working out, but it's a constant communication between the patient, the nurses, myself, and then they're learning about their disease process. And I personally believe that an educated patient is a much better patient because they know, it's not just knowing what's wrong with you and what medicine to take, it's knowing why. What is wrong with me? How can I understand this? And therefore they can learn to manage their own disease with my help.
Right. And
instead of me just telling them, take this pill.
Right, because you need to kind of change your life.
Absolutely.
And all the different things that led you to this, you need to kind of figure out a different route.
And many people tell me after they get a stent, or if they've had a heart attack, or if they've had open heart surgery, they say this is a life-changing event for me. And they stop smoking, they lose weight, they exercise, they really change their life around.
Yeah. One thing, I've got a friend who had a 99% blockage in the main artery, and it was a really scary event for her. She got the stent and all of that, and I think what scared her the most was knowing how much to exercise afterwards, and knowing how much to push herself, and am I going to do something that's going to hurt myself? So what do you recommend for those people in those situations?
That is exactly why we have cardiac rehab, and many people ask me that. This is exactly why we have this rehab, is because not only are they exercising in front of nurses, they have an EKG lead on them, they're watching their heart tracing, so you know exactly where your safe points are. It's all part and parcel. There's all a reason for what we do, and it's all disease management, patient safety, getting that patient to get to the best state of health that they can get to. And again, this cardiac rehab is just an excellent way to take care of that.
Yeah, it sounds like it. Very educational, and learning how to manage the disease and move on with your life.
Absolutely.
So what about prevention? Let's talk about prevention, and we got just a couple of minutes left here, but what can we do to kind of prevent going down this road, if any?
All things in moderation. We all know the right things to do. We all know that keeping our salt intake down, our fat intake down, a healthy diet, lots of fruits and vegetables, daily exercise, and it's a struggle for many people.
Yeah.
But everybody knows the right things to do. And one of the things I tell my patients is, the stent and the medicine, that's the easy part. The hard part is changing your lifestyle.
Yeah.
That's where the hard part is, because it's a hard thing to do. There is no quick fix. You open up that artery, but if you don't change your lifestyle, guess what? That plaque is going to be laid down over time again, and you're going to be right back in that situation again.
Yeah, nobody wants to end up there again.
Right. And so that's why I say it is a partnership.
Yeah. So prevent, eat healthy, drink lots of fluids, water, do your exercise, do what the doctor tells you.
That's probably good advice.
Yeah. So, all right. Well, the Heart Center is opening soon. It's not
October
open yet.
October 8th is the temporary date, and that's always a moving target, but October 8th is what they're planning on right now.
All right, well, that sounds good. We've covered a lot of topics today, so lots of information was given to our viewers out there. I thank you for being on the show.
Thank you again for having me.
Pleasure talking to you.
You too.
Thank you. And thank you for watching this episode of Being Well. For more information, tune into our website at weiu.net. Click on Being Well. We'll see you next time.
Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System.
Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
At HS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HS St. Anthony's Memorial Hospital.
Carle combines clinical care, health insurance, and research in a way that solves problems today with an eye toward the future. Supported by a deep philanthropic spirit and dedicated to making life better for as many as possible.